As you may have just heard from the Ministry of Health, the tests carried out in one of our laboratory on the 6 people in quarantine at KMTC facility returned with 1 positive case for COVID-19. This brings the total number of tests done at Wajir County Regional Laboratory to 24 since 23rd April 2020. This positive case is a 36-year-old Kenyan from Garissa County who was intercepted at DIF of Wajir South Sub-County along with 3 other persons on their way back from a livestock trade trip to Mogadishu, Somalia. The patient is symptomatic and is in a stable condition. He's also in isolation at Wajir Referral Hospital. A police officer who was manifested suspicious symptoms and traveled recently from Kakamega County was quarantined at Eldas Sub-County Hospital. Public health officials and disease surveillance teams collected a sample that tested out to be negative. Ladies and gentlemen, following the confirmation of the first case in our county, we must enhance our preventive strategies and stop further spread of this disease. We have therefore put in place the following measures and appeal for your cooperation. 1, teams of senior public health officials with medical supplies will be set base at DIF, Dajibula, and other border towns, and will carry out intensive campaign, screening and fumigation of public places. 2, it is imperative that we now contain the disease in DIF and prevent further spread. Towards this end, together with the county commissioner and the security team, we have directed lockdown of DIF for an initial period of 14 days, with effect from the coming Sunday, which is 3rd of May 2020. However, vehicles carrying food supplies and others that are working to prevent this disease, for example, the public health officials, their vehicles, and the security, are exempted. Number 3, the closure of DIF and Dagahle livestock markets will be effective from the coming Sunday of 3rd May 2020. 4. Our referral hospital houses the main isolation ward that has now one of the confirmed cases. We must therefore enforce infection prevention and consequently have suspended outpatient services for the Wajir County Referral Hospital with effect also from Sunday. So before that, the dispensaries and the health centers within the town will be given full capacity in terms of equipment and personnel. Only those who are referred from the sub-counties and from the health centers in the town will go to the referral hospital. This is to prevent further spread of the disease. We therefore ask the public to cooperate. This will be effective from Sunday. More staff and drug supplies will be provided at our health centers and dispensaries in Wajir town to accommodate the upsurge of service seekers. We plead with the public and social media platforms to be sensitive to the patient under the treatment of this for coronavirus. The healthcare workers offering care and stop stigmatizing and traumatizing their families. Please, let us not look for the name of the patient. Even myself, I do not know, and I don't have to know. Our responsibility is to ensure that he does not infect others and that we give him all the care. In Mandera, you have heard what happened. They put their names of the patients in the press, and now they are facing court action. We don't want a similar situation. Tracing of persons who may have come in contact with the patient and those in quarantine is ongoing. We seek for your full disclosure in case you have reached out by the surveillance team. Ladies and gentlemen, I sincerely thank our frontline healthcare workers, chiefs, security personnel, and the public who have made these tireless efforts in combating the pandemic. In fact, most of these cases were reported by the chiefs and the security forces. We thank them very much. I also urge the Department of Health, together with our partners, to put extra efforts in the prevention and control of the disease now that COVID-19 is with us in this county. Finally, let us not panic, but instead be vigilant and report on any anomalies detected. Let us continue with our prayers, especially during this holy month of Ramadan, and keep on embracing the recommended social distance, washing hands with soap and water, using sanitizers also, wearing face masks at public gatherings, and above all, staying at home. Thank you very much, and I thank you all.